This is a devastating injury, and it's something that's very prevalent in sport, and increasingly patients will hear about this in the media, and then eventually it can happen to them.
Yeah.
But it's a very confusing world because they're trying to understand rapidly what it means and what really would be the best approach to their care. Okay. So the cruciate ligament is indeed the cornerstone that stabilizes the knee.
Okay.
And the intriguing thing is, although it's such a strong ligament, often it gets injured without any contact in sport. And this throws people.
That sounds horrible.
No, it's true. 70% of cruciate ruptures happen without any contact. You can be...
That's a scary statistic.
Indeed. And it's not as if you're not fit or you're not participating in sport on a regular basis. It can just happen, and it would appear randomly.
Yes, you're making this worse again, Gordon. This sounds really, really scary. So how can it happen then? Why does it happen?
You should just give up sport, actually. That's
Well, I'll give up and go home now.
That's the message. That's the safest approach.
No,
Chess.
No, it's not. It's not. Being active is good. It's still a good thing. How does this sort of injury occur then?
The cruciate ligament helps to hold basically the thigh bone and shin bone together.
Okay.
So when you rotate and pivot in particular, this is a crucial stabilizer. But it doesn't work on its own. It works with the support of other ligaments and with the muscles around the knee. Now, if these other structures are inhibited or weakened, then it puts too much stress on the cruciate ligament itself.
Right, okay.
And it gives rise to a classic sensation. You feel as if the bones displace.
Oh.
You get a pop, or your other teammates might hear it, a pop or a crack. And then you develop a rapid swelling and you're left thinking, oh, is this serious or not? Sometimes it can be very painful. Sometimes it can be surprisingly mild. Players will take 5 minutes to catch their breath, think, I don't think this is so serious. It's probably okay. And they get back up. And that's usually a fatal mistake because they get 5 minutes at most, maybe 2 minutes. And then they go down. And often when they go down the second time, they really do the damage to the knee.
So how serious is an injury to your ACL or your cruciate ligament?
It's not as devastating as it used to be. It used to be a career-ending injury. So people would just say, my knee's gone. And it would almost imply the end of their, say, footballing or netball career. People had an understanding. They didn't really know what it was, but they knew that if their knee went, then when they played, the knee would buckle, it would swell up, it would be painful, and there would be that steady deterioration. Technology is changing, obviously, and we can approach it much more optimistically. It helps if we can diagnose it at an early stage and manage it appropriately.